Hello, this is Zana, the tech guy from Vigilius. Today I'm going to show you how to use the handheld device to do different portions of the medical exam, such as zooming in, doing a full ear, nose, and throat examination, adding a magnification lens so we can look at portions of the body very closely. So let's start. First we're going to turn on the screen, second button from the top. Then we turn on our device, the handheld device. Slide, enter your passcode. Remember, you open the VC application, which will take you to the address book. Turn on the speaker, which is that top left button on the speaker. Once our address book is open, we find the person we'd like to reach. Tap on their name, press the call button to initiate the video conferencing session. Here we go, we've got the doctor. So now we'd like to perform, of course, a closer examination of the patient. The advantage of having a MITEE is you can now slide the handheld out and use it as an examination tool. The first thing to do when you've taken your handheld out of its docking system is to swipe your finger from top to bottom. This will open up a screen where you can actually lock the screen of the exam tool. I suggest you do this in your general practice. As soon as you take the handheld device out of its dock, you lock it. The lock button is the little button with the lock and the circle around it, which I'm going to press now. So now our screen is locked, which means regardless of where we turn the handheld device orientation, it'll keep that orientation. And you will notice that your own screen, which is down, is approximately the same size as the top screen, which is the person you're talking to. This will enable you to actually see on your end the structures that you are zooming into or focusing into. So once we've got that done, so the next step is to tap on the screen itself. And you've got your various icons as we've reviewed in our previous video. This is the microphone icon to mute the screen. This is the camera icon. So the camera icon allows you to flip between the front and the back camera. And we're actually going to use the back camera now because that's the higher resolution camera. And that camera will allow us to use the flashlight to do things like look in the mouth, as well as look in the ear, and use the light to look at other portions of the body. So remember, you tap on that camera icon, it'll bring up a menu where you can actually turn the camera on and off, but also flip the camera. So I'm going to flip the camera now, and now I'm looking to the back camera. So so you can see that in my hand here, I'm looking at through the back camera. Once you have the back camera on, if you press on the cog wheel, it'll reveal a menu where you can actually turn a light on, and you can see now we're looking through the back camera with the light on. So I'm going to put this aside and show you. Every MITEE comes with this kit. This kit has this kind of container which has an adapter. It has a pouch which has a magnifying lens, which we will get back to you. And it also has this additional adapter. So this additional adapter, I'm now going to show you how to transform this handheld device into an otoscope. So to do this, we slide this adapter on top like this. Actually, like this. So from the back, you're going to slide it like this. So this is what it looks like from the front and the side. You slide it all the way on securely. Once that's on there, you can now slide your otoscope attachment this way until it clicks. You want to hear a click. And you look on your screen. If you see a circle in the middle, then you know that you're in the right, that you've configured the device the right way. So now we've turned the handheld into an otoscope. This otoscope, of course, will take any standard Welch Allen or speculum that you have in your hospital. and the speculum goes like this and screws on this way. Now we're ready to look in a patient's ear. But before we do that, don't forget to press on that cogwheel, turn the flashlight on, like this. And now we're ready to look inside the ear and do an ear exam. So, to dismantle this, we turn the flashlight off, slide the piece out this way, and then this way. And there you go. We'll put those away for later in a safe place. Now we're gonna go. Talk about how to use the magnifying glass. So the magnifying glass is basically this piece right here. It has actually 3 lenses. So one lens, which is screwed onto it, is a 14x lens. Once we put the 14x lens and screw it on to this other lens, the 7x lens, it makes that 7x lens a 14x lens. On the back of the 7x lens, which we have right here, is a 21x lens. So in general, you will seldom be using the 14x and 21x lens. So I would leave the 7x lens ready for your examinations. To fit this 7x lens on the handheld, take this rubber adapter that is inside the lens itself, fit it over the handheld device like this, and all you have to do then is slide the lens on top. And now you're ready to do your examination. You will notice that when the lens is on properly, objects far away will appear very blurry. However, you'll notice that objects close will be in quite high resolution. So that's how you put the magnifying glass on there. And of course, with the handheld and the back camera, you can zoom into any part of the body or person or structure that you'd like to see. Once you're done using the exam tool as a handheld, I want you to remember to switch the camera back to the front camera, so we'll do that here. And then also remember to unlock your screen orientation. So to do that, remember you swipe from the bottom to top, unhighlight the lock button, which is this one that I'm pointing to, the one with the lock and the circle. And then once you're done with using this device as a handheld, you're ready to put it back in its docking system just like this. It takes a couple seconds and you're ready to resume your video conferencing on the larger system. Thank you.